My name is Scarlett Lawson, and I wanted to present to you a theory. The comfort theory of nursing was developed by Katharine Kolcaba. She was a grand nursing theorist who contributed to nursing care by conducting analysis on comfort and research into literature on ergonomics, medicine, nursing, and English to then develop the comfort theory of nursing. Kolcaba is the author of The Comfort Theory in Practice, a vision for holistic healthcare and research. She is currently an associate professor of nursing at the University of Akron. She received a Distinguished Alumni Award from the Cleveland General and St. Luke Nurses Alumni Association. She was recognized as Who's Who in American nursing as well. Comfort in nursing is the passive, active, and cooperative satisfaction of basic human needs for ease, relief, and transcendence arising from situations in healthcare. The states of comfort are often overlapping, interdependent, and continuous. Comfort is diverse in meaning, resulting in a verb, adverb, noun, or adjective. Comfort was a large part of nursing practice in the past, currently, and in the future to come. Comfort can be considered negative, meaning an absence of pain or discomfort, neutral, such as a patient being in a state of ease, or positive, a state of hopefulness. Comfort can be a process or a product as well. A comforting process is the state of which nurses are comforting the patient, and the product of comfort includes the patient's verbal statement of feeling comforted. Dimension 1 of the comfort theory of nursing includes relief, ease, and transcendence, as we spoke of earlier. Relief is the state of having specific needs met. The needs of the patient are assessed and addressed, and goals previously set are met. Relief is necessary to return to a previous state or a peaceful death. A therapeutic nurse-client relationship is the key to achieving relief. Now, for example, upon assessment, a PRN dosage of Tylenol, 650 milligrams, is given to a patient with a pain rating of a 7 on a 0 to 10 scale. Upon reassessment for effectiveness of the medication, the patient states that his pain is a 2 on the 0 to 10 scale and currently at a state of relief. Continuing on with the first dimension of the comfort theory of nursing, ease is a state of contentment or calmness that is necessary for performance to be efficient in nursing. Homeostasis can occur when a patient is at ease. Examples of ease a patient can experience include proper body mechanics, control of room temperature, elimination issues have been resolved, nutritional needs are met, ease of respiration, and communication needs are met as well. The last portion of the first dimension of the comfort theory of nursing by Katharine Kolcaba is transcendence. Transcendence is the state in which limitations are exceeded and the potential for extraordinary performance can occur. Transcendence can assist a patient in a state of which he or she can rise above the personal challenge they've set for themselves, or the nurse has in that case. Human beings strive to meet basic comfort needs. When these needs are met, a state of transcendence can occur. An example of transcendence is When a surgical patient, for instance, is able to exceed their daily expectations of sitting up in a chair for 1 hour post-op to 2 hours without any complications or complaints of pain. The second dimension of the mid-range comfort theory of nursing places the patient, family members, environment, and community into careful consideration. The second dimension carefully considers the context to which comfort occurs and is derived from holism, as mentioned previously. The subscales of comfort include physical, psychospiritual, social, and environmental. Physical needs, for example, are bodily sensations. Psychospiritual needs can include an internal awareness of the self that includes one's own meaning to their life, self-esteem, sexuality, and relationships to a higher being. Social needs of patients consist of family, interpersonal, and cultural relationships. Informational aspects of social life and financial aspects also make up the social comfort. Environmental needs the nurse must assess include ambience, light, color, noise, and temperature, also synthetic versus natural elements. Wall's evaluation model of middle range theories critique Kolcaba's comfort theory of nursing by adequately addressing the ethical, cultural, and social issues of patients. Comfort can be subjective and personal based on one's need. The taxonomic structures of Kolcaba's comfort theory of nursing measures comfort in not only a subjective way, but addresses the systematic determination of comfort with dimensions 1 and 2 as well. What one person experiences comfort is not always what another person may feel as a state of comfort. That always must be considered when nursing. Comfort must be addressed by the nurse after an established, trusting nurse-client relationship has occurred. Assessment of comfort is also performed before and after nursing interventions have been placed. Health-seeking behaviors can increase comfort and are viewed as internal or external. Internal health-seeking behaviors are measured at the cellular level, and those include assessment of immune function or healing. According to Wall's evaluation model, the critique of a scientific level are adequate to the standards in which health statuses were measured of a patient in a state of comfort. The result is a positive view of one's health and well-being, and in turn that assists one to a state of transcendence. External health-seeking behaviors, on the other hand, are considered to be occurrences in the outer world, such as health maintenance programs, health statuses of the patients, and self-care activities the patient is involved in or chooses to be involved in. Wall's evaluation model of consistency and persistency prove the comfort theory of nursing to be efficient by the measurable aspects of healing and by the trends of vital signs towards the positive side. Obviously, they're improving. That means the comfort theory was great, was utilized perfectly when nurses did use that. The more a patient is involved in healthcare and in health-seeking behaviors, whether the factors be internal or external, the more likely he or she is to trending towards the state of comfort. Internal and external health-seeking behaviors or peaceful death are adequate outcomes to achieving comfort. Comfort is needed when an outstanding need arises from a situation that causes tension to be negative. This negative tension, it exists from an imbalance of facilitating and obstructing forces. the needs of comfort are identified, assessed, and interventions are placed, leading negative tension into a positive direction. The patient perceives the tension and they decide if the nursing interventions have changed it. The nurse decides if the interventions have assisted the patient in achieving the goal by assessing his or her perception to the comfort of subjectively or objectively. A comfort increase occurs when patients' tensions overpower the negative ones. Katharine Kolcaba's comfort theory of nursing has potential to direct the holistic effects of caring for patients from healthcare providers for many years to come. It can be utilized in all characteristics of nursing care because it is measurable and positive outcome. The comfort theory of nursing facilitates physical or psychological performance gains, as well as facilitating a peaceful death because of the psychic strength necessary for acceptance and release when a patient passes. It can be utilized in many aspects of nursing, including pediatric comfort, gerontology, and different ranges in age. The outcomes of the comfort theory of nursing is nurse sensitive because nursing interventions do influence it. At times, comfort takes the place of more narrow outcomes from separate measurements, but it is richer in its own way because of the interaction between comfort aspects. The goal of the comfort theory of nursing is to increase patient satisfaction with the use of physical nursing interventions, as well as increasing the awareness of comfort in society as an important aspect of the nursing process. When utilized adequately, the comfort theory of nursing can assist hospitals and institutions in improving patient and family outcomes, decreasing costs related to readmission rates, assist in early discharge, and increase nurse and caregiver satisfaction related to the care that they provide to their patients. The comfort theory of nursing by Katharine Kolcaba can be built upon and utilized by nurses to situation-specific circumstances that may be used more appropriately to assist in a more positive patient outcome. Thank you for listening and viewing the comfort theory of nursing, and I hope that you utilize the tools that Ms. Kolcaba has set out for us nurses in your current practice, as well as your near future for nurse practitioners. Thank you and have a great day.